Hello everyone, my name is Julia. I'm a birth doula, and today I'm going to share some common interventions that you might encounter if you are birthing in a hospital in the United States. The first thing I want to talk about are inductions. Now, inductions are artificially and medically starting labor, so labor not starting spontaneously. There are several different forms of inductions, and I think some might not even consider some of these inductions, but let's get into them. The first being a membrane sweep, also called a stretch and sweep. This is when your provider really inserts their fingers and kind of stretches and sweeps around your cervix to separate the amniotic sac and ideally put you into labor. Some people don't consider this a form of induction. I certainly do. And these can be offered to you in your provider's office starting at like 38, 39 weeks. So really dig into everything that goes on with a membrane sweep. Some other forms of induction include cervical ripening agents that can be taken orally or vaginally, something like a Foley balloon, Foley catheter, an AROM, artificial rupture of membrane, and Pitocin, which I will talk about a little bit later. But all of these are considered forms of induction. Some of the pros are that it puts you into labor and you get to meet your baby. But induction often, at least in my practice, leads to a lot more frequent use of medical interventions and a higher likelihood of having a C-section. What choices do you have when it comes to inductions? I would have a very honest conversation with your provider about what each of these entails and why you might be a candidate for any of these. Talk about any alternatives that you might have, and if there's any option to wait and just push out that induction and see if you go into labor spontaneously. Next intervention that you are most likely going to be offered is continuous fetal monitoring, where you have two Dopplers strapped to your belly with usually two straps or a tight belly band. One would be on top of your fundus, which would track your contraction pattern, and the other one would track your baby's heart rate. One con that I feel like continuous fetal monitoring has in labor is that we are sucked out of our own bodies. We are hyper focused on the monitor and looking at the baby's heart rate and the pattern and the timing and the beeping instead of looking at the birthing mother right in front of us and being like, okay, what are her cues? What is she feeling? Some women don't care if they have this continuous fetal monitoring going. It doesn't pull them out of a relaxed body and mind. More likely than not, I think it does. So some options that you have would be intermittent fetal monitoring, where they would just test you maybe every hour, every 2-3 hours. Doppler monitoring, where they can come in. A lot of midwives use Doppler monitoring. Sometimes there are wireless monitoring. I've even seen some hospitals have Bluetooth monitoring. Now, you can still move around if you have continuous fetal monitoring. It's just a little bit more cumbersome. And another con would be that you can't then submerge in water if that is one coping strategy that you want to use. The next intervention are IV fluids. This is often standard practice. Once you are admitted into the hospital, you will be given an IV drip. So some of the pros for IV fluids are if you're feeling nauseous or can't keep anything down, it keeps you well hydrated. But if you are not feeling nauseous and can eat and drink your coconut water, have your electrolyte drinks, there's really not a need for IV fluids. So some cons include you having water retention, you feeling really bloated, and sometimes it makes your baby feel a little bloated as well. So your choice. If you can stay well hydrated, talk to your care provider about maybe having a HEP block or just declining an IV altogether. The next intervention are cervical exams. This is when your provider inserts two fingers to see how dilated, how effaced, and what station your baby is at. Now, does this give you any indication of when baby will come? No. Are they uncomfortable? Yes. Do they often stress women out and stall labor? Also, yes. Do with that what you will. Moving right along to Pitocin, which is synthetic oxytocin. Synthetic. Chemically, is it the same as what your body produces? Yes, but does your body react to it in the same way as natural oxytocin? No. Some would consider the pros to be they increase the strength of your contractions, and if labor isn't progressing, then it'll help move it along. But Pitocin contractions suck. They suck. It is probably the most excruciating pain that you will ever feel in your entire life. When you introduce Pitocin, there is an increased likelihood of using pain medications, such as epidurals. Let's glide right on into epidurals. An epidural is a pain relief option where an anesthesiologist would put a small tube or catheter into the lower part of your back, which would then numb you from the waist down. Now, you will still have some movement and sensation, but you shouldn't feel any real pain. You'll still feel the pressure of labor, which we honestly want, but you won't be You can usually sleep through an epidural. Now, epidurals don't always work. Sometimes they only work on one side. Sometimes they don't work at all. Sometimes the placement is off. And a lot of times with an epidural, it slows your labor down, and oftentimes, then your provider will likely want to introduce Pitocin. Food for thought. And now we're talking about AROM, or artificial rupture of membranes, or breaking your water. It is when your provider takes something that looks like a crochet hook and breaks your amniotic sac. Now, the idea of breaking your water would be to speed up labor, get things progressing. But some of the cons include introducing bacteria and an increased risk of infection for your baby. So, as long as your baby is in the amniotic sac, there's less likelihood of your baby getting an infection. So, what is your choice? You can wait until your water breaks naturally, and that is usually when you are well into active labor. I think we have this idea, especially from movies, that, your water breaks and then you're in labor. And that's not often the case of spontaneous labor. A lot of times you'll be feeling contractions for a few days, hours, and then your water breaks. It's not like the movies. Last intervention that I'm sharing today is an assisted delivery, which is usually done with a vacuum or forceps. The pros to this would be avoiding a cesarean. Some of the cons can be an increased risk of tearing and bruising to your baby. Again, do your research on assisted deliveries and discuss if your provider is open to doing these, if they have any training or skills, have they ever done anything like this before. Get that information so that you can make the right choice. Those are just some of the interventions that you could be offered if you are laboring and birthing in a hospital in the United States. Now, I am not anti intervention. I think interventions save women and babies' lives every day. Do I think that some of these things are overused? Absolutely. And I just think we need to educate ourselves on what each of these entail and what are some of the benefits, risks, and alternatives that you can have. Remember that every birth is unique. Yours is no different. And I want to give you the tools and resources so that you can have an empowering, positive birth. Thanks for watching.